Good morning, Dr. Javvaji.
Good morning. How are you?
Great. You ready to get the day started?
Yes.
Let's do it.
Yeah, all right.
Are you ready to answer some questions?
Yes, I am.
When did you move to this beautiful new location?
I came here just before Christmas.
Wow, so you've only been here a few months.
Yes, only a few months.
So how did you go from that old little office and create this vision?
Well, I really wanted to incorporate both of my passions, which is wellness and geriatrics, into my own little clinic. And I think I've accomplished it here because it's on the first floor, unlike the other one where my patients had to walk all the way up. And now it's, you walk right in, and as you're gonna take a little tour with me, you'll see all the little details that I put in there.
What about this beautiful picture? Where did you get
This, I got this from Ukraine, and I was crossing my fingers that it would come because I fell in love with it. It's me. The left and the right is so me. I love all the colors in the right because I get very creative and I love like incorporating that into what I do. So yeah, it sums it up. That's the medicine and that's my colors.
Wow, it's beautiful. Give us a tour of this office.
Yes, follow me.
Is that a phlebotomy chair? You do labs here?
Oh yes, it's a one-stop shop. So my patients come here, they get everything. They get their labs, they get their memory checked, they get the whole works.
Wow, so
Here,
what?
I'll show you. I'll show how, if you were a patient, you'd follow me.
So what's the flow? What would we expect?
So my patients would come in here to get checked out. We'd naturally take their weight, and then we'd check their blood pressure, see where they are, get their vitals. We also do something very unique here. We test out their balance on this thing, and it is basically, it tests your vestibular system. It looks at the eyes, ears, and brain, and they're usually in perfect harmony. But as we get older, that harmony breaks, and there's no way to tell if your balance is good just by looking at you. So this machine picks it up and takes the guesswork out.
Well, tell me again, what do you specialize in?
Internal medicine and geriatrics. So internal medicine is adult medicine, and geriatrics is 65 and above.
All right. So this is beautiful. I'm looking at these beautiful barn doors. Like, where did you get this vision?
Oh, yes. So these barn doors are actually for my patients. I love the way they look, but I also did it for my patients because my patients are 65 and above, most of them. I see younger patients, but 65 and above is what I specialize in. And some of them come, the older ones, especially in their 90s, they come in their walkers and their wheelchairs, and I want them to have independence. Like, that's the most valuable thing. As you get older, you miss your independence. So when they are walking here with their walkers, and they can just walk in with their walkers and their wheelchairs, and they can even open the door and slide it in themselves, and it gives a very aesthetic, nice flow to the room.
It's beautiful.
My props. I know you wanted to learn about these props. So these things are my go-to these days. I am a strong believer in getting enough protein as we age, because that is one thing that we all don't get enough of. And yes, everyone says protein, but I want to give you the specifics. Like, I will say, hey, for you, I think you would do better on this plant-based protein because it's less inflammatory, it won't hurt your gut, and you can do it daily without having any long-term side effects from it. And I put this in, marine collagen, to help your bones and your connective tissues, because those are the backbone of who you are. And as you get older, you won't feel the soreness and pain if both those components are in you. So I usually give my patients a little like cocktail, but obviously virgin.
Wow, you are so informative. Like, where did you do your residency at?
So I did my residency in Queens, New York. I was baptized in fire, basically. Queens, New York, they are very tough with their residents, and a lot is thrown at you very quickly. And that made me who I am today, because I love being challenged at work and thinking outside of the box. Yes, the textbook teaches me certain things, but there's a whole bunch that I learn actually from my patients. Every day I'm learning something new from my patients, and also the specialists that they see. I pick up things very quickly, and I love incorporating that into their life specifically.
So what did you do after that?
After residency, I went into fellowship, and fellowship was another move. Went from Queens to Connecticut. I did my geriatric fellowship there at the Yale Health System in Bridgeport Hospital. And that's when I learned all the things I was doing wrong in medicine. After I did a year of geriatrics, I'm like, wow, I really need to check myself on how I treat someone who's 65 and above, because you have pediatrics for a reason, and then you have geriatrics for a reason, and it's not the same.
How did you end up in Texas from the East Coast?
Oh, so my husband, he's a neurologist, and he signed for a position here, but I also just had my first kid at that time, and I wanted to be a mommy. And I loved doing that, but then it got old really quick. And I wanted to come back doing what I love, which is helping and talking to my patients. So I was thinking about going back to the hospital, but my husband wouldn't let me, because he said, you were pretty miserable there. And so he said, what do you need? And I said, I would love to start my own. And he said, here you go, start your own.
So what age group does a geriatrician see?
Geriatrician, we see 65 and above. And I think when you're 65, it's still pretty young. 90 is when I'm like, okay, fine, you get to call yourself geriatric.
Okay, so do you only see seniors?
No, I see 18 and above. But because I see seniors, I have I guess a crystal ball. And because of that crystal ball, I know what not to do when you're young, so you won't have to pay for it later, and I don't have to fix things as you get older.
Well, it seems like you're a strong believer in preventative care. Is that right?
Oh, yes. Preventative care is everything. The quicker I know about your problem, and the sooner I want to fix it. And actually, I don't want you to have the problem in the first place. So I want to go ahead and, help you both mentally and physically, because if I start early, I can actually prevent some of the problems that can occur later in life.
Well, can you name some of the things that a middle-aged person can prevent today?
Yes. So a middle-aged person can prevent, they can prevent their blood pressure from getting high. They can get a control of their cardiovascular health, their mental health. Did you know that dementia can actually be prevented if you start early enough?
Wow, really? Tell me about that.
So we have this cool machine here in the office, and it's actually a quantitative EEG. And I do this along with my cognitive testing with my patients, because it actually maps out the brain. And when you treat dementia, you want to make sure, or any memory impairment, you want to treat the underlying cause. As you age, not everything is Alzheimer's or dementia. It could be just untreated depression or OCD, or you're just not paying attention in the first place. So it's very important to tell, for my patient to know why they are experiencing these memory issues, and for me to treat it appropriately.
Well, how is the test done?
So you would just need to put a cap on, and it's a cap with electrodes in it, and then they put gel. It's just like ultrasound gel, and it picks up your brain waves in real time, and you just sit here, answer a few questions like, hey, press the button when you see the blue circle, and it picks up your brain waves to these minor little things, and it can actually tell what's going on with your brain in real time. Like, are you getting enough sleep? Are your brain waves really slow because you're depressed? Or just the stress on yourself?
So how long does the test take?
About 30 minutes.
Okay. So how can you decrease your risk for dementia?
Great question. So, decreasing your risk for dementia, I would say get your hearing checked because hearing impairment is one of the biggest risk factors for dementia. And if you're a smoker, quit smoking because it can do damage, a lot of damage to your brain. And also, if you're depressed, get it treated early because untreated depression for a long time can actually put you at risk for dementia. And we're in 2023. It's a fixable disease. You just need to ask, make your doctor aware that you're feeling these symptoms.
So you're saying that dementia can be prevented?
Yes, dementia absolutely can be prevented in some people. Like some people, they have a high genetic predisposition to it though, but most of them, if the brain is so plastic and as you age, it has the adaptability to grow new neurons and new networks. And if you challenge it, like exercise your brain like you exercise your body, your networks are so strong that even if some break, you have so much backup that you won't, even though you have little plaques, you won't have the symptoms because your networks are so strong. And that's why it's so important to, address this early and not later.
What is this machine right here?
So this is the ANS. It looks at your nervous system from here down, and it tells you your functional age.
What is functional age?
So we have two ages. We have your chronological age, which is your numerical age. Like say if you are, 40, that's your chronological age. But the way your body is aging is your functional age. And your functional age is from all the stress that you're feeling and all that is so someone who's 40 can actually be 60 with their functional age.
Okay. So tell me about this wellness division that you have incorporated into your practice.
This is the reason why I actually moved into this new place. So I got into this not really meaning to go into it, but now I have it and I'm embracing it.
So tell me about it. What do you have? What machines?
I have, the M-Sculpt Neo, the M-Cella, and the Excelus.
What is the Neo?
Oh, so come here. This is my Neo room. The Neo is a machine that can actually burn fat, build muscle.
Burn fat, build muscle. How does it do that?
Yeah, it's almost like witchcraft. But with this baby right here, it can, you could do your abdomen or multiple areas in your body that it burns fat and builds muscle using high intensity focused electromagnetic, high FEM procedures. And with that, it can cause muscle contractions, causing you to permanently get rid of fat and also have muscle and build muscle. There's no other machine like that can actually build muscle.
So what is this?
Oh, this is my happy chair. Patients can sit on this chair with their clothes on, and it will do 12,000 Kegels within 28 minutes. And Kegels actually help build up your pelvic floor. This is for people that want to improve their sexual function or have a little bit of urinary leaking, or they get up multiple times a day.
Does it hurt?
No, the technology is so good that it has a built-in system that gets rid of the lactic acid that comes, so you don't feel any soreness.
Wow. What type of patients have that done?
So anyone can have that done. Men, women have that done. Especially moms that have have babies, and the baby's been weighing on their pelvic floor for like 9 months. It can damage their pelvic floor. So it rebuilds that muscle, and as you get older, even sheer gravity. And for a male, it helps improve like erectile dysfunction because it brings more blood supply to the area, and it also helps with the little leaking of urine as well.
So what's in here? What's in this room?
Oh,
What do you do
this
here?
is my Excelus Ultra, and the Excelus Ultra, it is a skin tightening machine. So I am not a huge fan of pills and needles, and I love to go non-invasive. And this is why I have this M suite basically with these machines from BTL, because it's very non-invasive. There's no pills, no needles. So you're gonna get skin tightening, that fresh Botox look, but without that Botox plasticity. And it's going to look very natural and flawless. And this one can actually like tighten up stretch marks and loose skin. So once we do the Neo and build the muscle, now you're gonna have that loose skin. This one can help iron that out. So it can help with the loose skin, all without no surgery, no pills, no needles.
How many sessions?
So the Neo, you would need 4 sessions to start with. The Exilis, you would need 6 sessions, twice every 3 weeks. And then the Exilis Ultra, it's once every 2 weeks.
So are you taking new patients?
Yes, I am. We take 18 and above and 65 and above as well. And yeah, come.
And what insurances do you take?
We take all major insurances, including Medicare. Obviously, I'm a geriatrician. I can't have to take Medicare.
Okay, well, I guess the most important question is who helps you run this operation on a day-to-day basis? Because I assume you can't do it yourself. What's your secret?
Oh my God, can you imagine if I did all this? It's this beautiful lady right here that helps me run this show. And honestly, you see me, you see her, you see her, you see me. And we've been thick as thieves since the beginning. Found it out.